Hello and welcome. In this video, we will learn about the knee osteoarthritis, both uni-compartmental and total, and we will look into a solution for both that stops friction and pain and may help you avoid the knee replacement surgery. Let's dive right in. If you find this video useful, please like and subscribe to my channel. During my search for a cure for osteoarthritis, I tried several treatments, but to keep this short, I will limit myself to what I benefited from. Many suffer from knee OA, also known as degenerative joint disease. It's caused by muscle weakness, excessive load on the knee joint, the wrong posture when sitting for long periods, malnutrition, being overweight, and knee injuries, in addition to the presence of genetic factors and other causes. Osteoarthritis in the early stages may affect one compartment of the knee joint. This is what I suffer from. In advanced stages, however, the friction develops to include both sides of the knee joint, and we will explain both cases later. What helped me get rid of the pain, stop the friction, and maintain my mobility was a technology represented by a brace that was installed on the knee. Two types of braces will be explained. Firstly, the brace is for those who suffer from osteoarthritis in one compartment of the knee, then we will discuss another brace that is suitable even for those who suffer from advanced OA that affects the entire knee joint. If you suffer from OA in the entire knee joint, keep watching to the end of the video. Let's start first by talking about the first type of braces, but before that, and in order to understand how these braces work, it is necessary to identify the knee joint in simple terms. This is the knee joint, as you can see. Meeting at the knee joint, the upper end of the shin bone known as the tibia, and the lower end of the thigh bone known as the femur. We will focus first on the upper part of the knee joint, which is made up of the lower end of the femur. We see here the femur, and this is its lower end. We note that it has two epicondyles. One is lateral, i.e. on the outer side of the knee. The other one is medial, i.e. on the inner side of the knee, that is, close to the other knee. These two epicondyles play a role in uni-compartmental knee OA. Here we see the entire knee joint. We also see the articular cartilage, which is the smooth surface that covers the end of the bone. Its function is to surround the ends of the bones to protect against friction between them. It also facilitates the movement of the knee, such as flexion and extension. The knee joint is the largest and one of the complex joints in the human body. It consists mainly of three subjoints, also called compartments, so that each of them has a distinct function and special pathological conditions that distinguish it. These compartments contain points of contact between two bones in each compartment as follows. 1. The patellofemoral compartment, in which the kneecap, patella, meets the femur. 2. The middle or inner compartment of the knee, where the inner part of the thigh bone near the other knee meets the inner side of the shin bone. 3. The lateral or external compartment, in which the outer part of the thigh bone meets the outer part of the shin bone, as shown here. Each of these three compartments in front of you has an area of contact where osteoarthritis usually originates. I was diagnosed with a medial compartment osteoarthritis. The braces that helped me stop the pain and prevent friction is a type of knee braces known as unloader knee braces, which takes the load off the arthritic compartment of the knee and shift that load to the sound compartment. This leads to pain relief and improved joint function. These braces are only suitable for those who suffer from OA in only one compartment of their knee. Some of them are intended for those who suffer from inner side, medial, osteoarthritis, while others are intended for those who suffer from outer side, lateral, osteoarthritis. It is important therefore to know the affected compartment of your knee before purchasing a brace of this kind. How does this type of knee braces work? They work by using a 3-point pressure system to take the load off the affected compartment of the knee and shift that load to the healthy compartment. Here is an example of this type of braces. This particular one is intended for those who suffer from medial OA. Therefore, the outer side of the brace is hard. It has two straps that wrap around the thigh and two that wrap around the lower leg. The extent of their tightening is controllable to fit the patient's leg size. It has a hole for inserting an Allen key that controls the angle of the brace in such a way to force the knee to bend away from the painful compartment of the joint. This X-ray on the left shows the narrow joint space in the knee affected with uni-compartmental osteoarthritis. Note on the right side how the narrow space was normalized by the brace. Let's look now into those who suffer from osteoarthritis in the entire knee joint. The unloader brace is designed for those who suffer from uni-compartmental OA. As we said earlier, try to treat osteoarthritis by redistributing the load between the two biofemoral compartments, i.e., from the affected compartment to the healthy one. While this may benefit patients with uni-compartmental OA, research shows that nearly 90% of patients have osteoarthritis in 2 or 3 compartments of their knees. So, this kind of braces will not do them any good. This brings us to the braces for those with OA in the entire knee joint. A Canadian company called Spring-Loaded Technology has developed the next generation in knee bracing for patients with osteoarthritis and knee injuries with a tri-compartment unloader technology. Equipped with patented liquid springs, the tri-compartment unloader is the only brace capable of reducing forces throughout the whole knee. They called it levitation, with a technology capable of significantly reducing pressure on the entire knee joint, that is, on the 3 compartments of the knee joint, as it is equipped with patented fluid-operated springs. It uses a hydraulic suspension system, compresses fluids in an ultra-strong cylinder to store energy when the knee is bent. Thus, this brace is the only one, as of the date of this video, that is able to reduce the weight of the entire knee joint. Independent research has shown that this new technology can reduce the load on the knee joint by up to 64%. This decrease in pressure across all 3 compartments of your knees can quickly reduce or eliminate pain, allowing you to get back on your feet and do more of the activities you love. To understand how this brace works, imagine using it to perform a squat. As you bend your knees to squat down, the pressure on your knee joint increases to 7 times your body weight. The spring then decompresses and releases this energy, and this released energy will help your muscles help you stand and reduce the forces that your thigh muscles exert on your knee. By absorbing body weight and helping to extend the knee braces of this type can reduce pressure and pain throughout the knee's range of motion. I hope that I have succeeded in what I presented, and I hope that you will help me in spreading this video to reach as many knee osteoarthritis sufferers as possible. Thanks for watching. I'll see you in the next video. Take care.